Hello everyone, good evening. Welcome to BMC Global Live AlHilal Health World, nothing but lifestyle. As you are aware, this is a talk show with the expert doctors of AlHilal hospitals and medical centers. I am Jessila Mujib, your host for today. The doctor joining us today is Dr. Muhilan Jegadeesam from AlHilal Hospital, Manama Central. He is a specialist dermatologist with an experience of more than 14 years. And let's move on to the doctor and know what the topic of discussion would be today. So, doctor, welcome to the show.
Thank you.
And thank you for joining us today. And doctor, what would be the topic of discussion today?
Today I want to talk about skin care with the different weather changes.
Okay, doctor. So, we are having winter in Bahrain now. So, what is the skincare routine you would suggest for winter?
In winter, especially when the temperature drops, the humidity also drops, and this can lead to more dryness of the skin. So people who have the tendency to have dry skin and who especially sensitive skin have to take extra care during winter, increase the use of moisturizers and stick to a good and regular skincare routine so that they don't end up with any skin problems. People with sensitive skin usually are supposed to use regular moisturizers, avoid as much as soap. And people with normal skin, even they tend to have drier skin in winters. So they will have to start using regular moisturizers so that they don't end up with any skin problems like itching or eczema. And I would say that soaps, as much as possible, avoid using soaps during winter. And if at all you're going to use soaps, use some bath oil or like natural oils to apply on the skin before taking a shower, and avoid taking very hot showers which can again dry your skin. As much as possible, use room temperature water for showers, and immediately after you shower, when the skin is soft and easy to absorb the moisture, that is when you have to apply the moisturizer and give some time for the skin to take in the moisturizer before putting on the clothes. So that is one thing definitely everyone should do. Use good and regular moisturizers.
So, doctor, what are the skin diseases that aggravate during winter?
Most of the skin diseases associated with dryness like psoriasis, eczemas, atopic dermatitis, and people who are born with a tendency for excessive dryness of skin. So these are the things that worsen during winters. So those people will have to, as I said before, increase the use of regular moisturizers or switch to intense moisturizers so that they don't have aggravation of the disease during winters.
So, the dry skin gets aggravated during winter. Doctor, can you suggest a skincare routine that suits every one of us?
Okay. There is no specific skincare routine that suits everyone because everyone's skin is different and the same person's skin is different at different stages of their life and different in different parts of their body. So, for example, when they're born, the skin is different, the requirements are different. As they grow up, again, the requirements change. And as they mature and as they turn old, again, everything changes. And especially during that teenage, different parts of the body have different requirements. The face will be very oily, where the rest of the body will be dry. So they will need something to remove excess oil from the face, while they'll have to use moisturizers to increase the oiliness of skin and the rest of the body. So there is no specific routine that everyone can follow, but the ideal thing would be to discuss with the dermatologist and see what their requirements are. They would be the best to suggest at that point in their life, depending on their lifestyle, which is the best skincare routine for them. That would be the ideal thing to do.
Now, doctor, can you suggest the skincare for people with acne?
Yes. People with acne usually tend to have very oily skin. So choosing the right face wash would be the ideal thing to help them in preventing the flare-ups of acne. Some are okay with just a regular cleanser, some would require intensive cleanser, but the important thing is to do is consistency. They will have to, whatever cleanser they use, the oiliness will return within a couple of hours. So they will have to take care to cleanse their face every 3 to 4 hours once during the day. That would be the ideal thing to do, so that this oiliness reduces. Once the oiliness reduces, they can prevent flare-ups. So that would be from the part of regular skincare for acne. People who tend to have like a severe form of acne, then they will have to add it on with other topical and maybe even oral medications. But regular skincare to prevent acne would be in keeping the face clear of oiliness. So regular and consistent cleansing of face with choosing the ideal face cleanser for them would be the routine skincare for patients with acne.
Doctor, you mentioned about moisturizer in your talk. Now coming about sunscreen. What type of sunscreen should I use? And is sunscreen necessary during winter times?
Yes. So sunscreen usage is essential for everyone depending on the skin type. So the skin types depends upon the melanin content. Some skin are fair, some medium, some dark. So everything comes down to the content of melanin in their skin. So depending on that, they will require sunscreen. So the regular available ones are SPF 26 and 30, which can suit everyone, and people who tend to get sunburn or people who stay in sun for longer durations, they will require SPF above that, like SPF 50, 50 plus. So that would be the requirement. So it again comes down to individual preference and how their lifestyle is. But I would say to start off with SPF 26 or SPF 30 would be the ideal thing. That is the minimum, so that it helps them stay longer in the sun and prevent any tanning or sunburn. And depending on their profession or their hobbies, they can choose other sunscreens.
And what about using sunscreen in winter?
In winter, though we think that the sun doesn't come out, the ultraviolet radiation still does. It reaches the earth. So we will have to use sunscreen even during winters.
So doctor, coming to anti-aging products, around what age you suggest people start using anti-aging products? And also about the anti-aging procedures, what do you have to say?
So anti-aging products and procedures, the anti-aging procedures, I would say not to start before 18 or 20 years of age unless there's a real requirement for any medical condition. But anti-aging products, especially sunscreen. Sunscreen is one good anti-aging product because it protects the skin, especially facial skin, from sun damage. Sun damage is one that can cause fine wrinkles and makes the skin age faster. So ideal, like essential and regular sunscreen usage and consistent sunscreen usage is something that by itself can help prevent aging. And other aging products which contain hyaluronic acid, collagen, that they can again discuss with the dermatologist to see if they really have a requirement, and they can start as early as 18 years.
Now doctor, what is your advice for our viewers regarding skincare? Can you put all your advice in a nutshell and give our viewers?
So skincare is a wide topic and it is different for everyone. One man's food is another man's poison. The same way, one man's skincare will not suit the other person. So it will have to be individualized, and I would say the best way is to have a consultation with a dermatologist, have them examine your skin and suggest the ideal and like skincare which would suit you and which you would be able to be consistent with, that is the best way to take care of your skin. Apart from other creams and lotions, there are some things which you can do at home to help keep your skin healthy. Water is something very important to keep your skin soft and supple, because almost 90% of the skin is composed of water. So keeping yourself well hydrated is one important thing, and also consuming good amount of fruits, vegetables, and other healthy food items is something that can really help give a good glow to your skin.
So, thank you, doctor. Thank you for joining us today and giving us all the valuable information about the skincare routine, especially in winter and throughout the other seasons. Thank you once again.
Thank you for having me here. It was a pleasure.
So, viewers, I hope this was a very informative episode. For more informative episodes, tune into BMC Global Live AlHilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jessila Mujib signing off. Good night.